DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to DocTalk. Today we're going to have a great show. We're at Texas Tech University School of Veterinary Medicine in Amarillo, Texas. Our guest today is going to be Dr. Jennifer Koziol. We're going to talk about replacement heifer strategies and raising them, heifer development, and much, much more. Stay tuned. This is going to be a great show.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cuperia, Nematodirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson. I'm here with Dr. Jennifer Koziol. We're in Amarillo, Texas. We're at Texas Tech School of Veterinary Medicine, where Dr. Koziol is an associate professor of food animal surgery, medicine and surgery. She's a tremendous bovine veterinarian. And when you get the combination, I always appreciated somebody that could do what they were teaching. And Dr. Koziol is certainly one of the elite practitioners, but also now coming back to give back to students. And what a great program y'all have here.
Well, thank you. It's great to be here. It's a fun program to be in. And we like to walk the walk and talk the talk. So.
Well, you're doing it, and it's been a great visit all the way around. But today, you and I are going to talk about heifer development.
Yeah, so talk a little bit about heifer development. Hopefully we start getting some regrowth of our herd. So hopefully it's a great time to start thinking about heifer development and keeping heifers or thinking about buying heifers. So
yep. So let's just start with how do we select one?
Yeah. So thinking about where we really want to start selecting heifers, we can start selecting heifers. Weaning is a great time to start thinking about where we're going to keep in the keep pen and what we're going to call, right? And so kind of going through there, and we can take lots of different strategies depending on your operation, right? But I always try to encourage my producers to think about, where are you going? Where do you want to be in 5 years, and where do you want to be in 10 years with your cow herd? Because these are the females that you're going to have in 5 years, and they're going to produce the calves that you want in 10 years. So really thinking about, where do we want to go and how do we want to get there? So we can think about physical traits, right? Frame scores, feet, legs, things of that. And then we can get into some genetic factors. Are we going to move more towards, like, we want to start freezer beef and we want more carcass qualities? Are we going to put calves in a feedlot, so we really want to hone in on those carcass qualities in our females? Do we need to really think about some maternal and fertility qualities in our herd? Where do we need to go? Where are weak spots? Where are strong points? And how do we want to pick heifers so that we just don't go in and pick the pretty ones, right? That's easy to pick the pretty ones, right? But really picking them with a purpose.
Yep. And does it matter when they were born relative to the rest of the?
Yeah, certainly we want to pick heifers that were born earlier in the year. We know that those heifers come from dams that were the most fertile, right? Those dams bred up earlier in the breeding season, and therefore they're probably our most fertile cows. And some of that will go down from the mom to the heifer, and hopefully we want that. We also want to pick heifers that come from our cows that have had a long longevity in our herds, right? Those cows that have been there for many years are going to be ones that will have some stability.
Yeah, and I'd always kind of heard someone say, buy the bull to match your market and buy the cows to match your environment.
Yeah, absolutely, right? We want frame score 7 cows not going to make it out here, right? We're in that high desert, right? So really, we want to match our cows to what we want to put in input wise, right? Feed costs are always a big thing to think about, and really think about what body frame size that we want.
Sure, sure. Well, that's a great way to kickstart us and
Yeah.
get us rolling on what to select.
Yeah.
When we come back, we'll start talking about how to grow them and how to raise them and how to develop them.
Yeah.
Great show today, folks. Dr. Jennifer Koziol. We're going to talk about heifer development. So come right back after these messages.
Hello there, Dr. Nick Wagner, Professional Services with Neogen, and today I wanted to talk about product labels and food safety. One of the first things that you want to make sure you do with injectable products when handling is make sure that you store them properly in order for them to be effective when you go to use them. The other thing is always check expiration dates, because you don't want to use an expired product, because that could lead to concerns with efficacy of the product, could lead to concerns with reactions in the animal, or is also concerned with the regulations from the FDA's standpoint. One of the other things then when you read that label, you want to make sure that you understand what the dose is and how you administer that product, whether it's an intramuscular injection or whether it's a sub-Q injection. Because if you're not giving the injection in the proper location or the proper tissue of the animal, it may impact the effectiveness of it, or the possibility that the body absorbs it differently and potentially could change withdrawal time. That's a concern with potential residues. And then that leads us into understanding and making sure you check the label for the withdrawal time, and then understanding what that is and making sure that it elapses before you ever consider any decisions to market that particular animal. And then one of the last things, keep records so that you know when you gave those treatments, so that again, you're able to respect that withdrawal time. But all of these things come down to making sure that we avoid any residues and we produce a safe, wholesome product for the consumer.
Thanks for watching Cattle Intel by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Jennifer Koziol. We're at Texas Tech University's School of Veterinary Medicine, where she serves as an associate professor of food animal medicine and surgery. We're talking about heifer development, and obviously when we wean them, we have different things from health and performance, but let's start out with vaccinations.
Yeah, so that's a great time after we've picked what heifers we're going to keep to get them on a solid vaccine plan, because they are going to be our cow basis for many years to come. So we want to vaccinate those heifers with a modified live vaccine, realizing that we may change them over to a killed vaccine as cows, but we really want to get their immune response up and going. And so those modified live vaccines are the way to do that, following that up with a booster in 4 to 6 weeks, and that really sets them off on a great way.
You bet. And then as we get closer to the breeding time, will we vaccinate them again?
Yeah, absolutely. We want to vaccinate them 4 to 6 weeks prior to breeding, ideally with another modified live vaccine. And that really kicks them over into being a cow and puts them in really great shape. Some really great research has come out of Auburn looking at challenging them, their vaccine status, and that really looks like the best way when we use modified live early on and repeat modified lives before breeding as first calf heifers, and then really going from there and turning them over into killed vaccines as cows. So
yeah, that's what I think that's a great foundation for the immunology of those cows.
Right.
What about nutrition and growth patterns?
Yes. So we can really let those growth patterns of the heifers be driven by our feed resources that we have. We know that we want to target those heifers to be about 55 to 60% of their mature cow weight at breeding. And so we can kind of backtrack and let those average daily gains really depend on our feed resources. So when our feed resources are really abundant, we're going to get more pounds of gain, and then we can kind of coast when we don't have those feed resources. So really good research has come out of Nebraska where we don't have to really target that 60% of the mature body weight at breeding. We can kind of cheat that back to 50 to 55% and not have terrible impacts on that first breeding, but we really have to increase once we've bred them. We really need to push them into as they go into that first pregnancy. So it kind of a little bit depends on the weather, what feed resources we have. And so it's really a great way to kind of manage your resources and realize that it doesn't have to be done one way. It can be done multiple different ways, and depending on whether we have lots of grass, short grass, drought year, what feed prices are doing. So we can really let the market dictate where we're going. We just know where we got to go.
Yeah. So the combination of vaccination, feeding,
Right.
Anything else in that time frame as we're getting them between?
Yeah, certainly right before, and not right before, it's ideally 4 to 6 weeks before we're going to start breeding. Going through and doing reproductive tract scoring and pelvic measuring are great ways to make sure that we are going to be breeding heifers that are going to get bred and do the job that we want them to do.
Good. Well, let's take a break, and then when we come back, let's go into some more of the repro tract scoring and that.
Yeah.
You're watching Doc Talk. Thanks for joining us. We're at Texas Tech. Dr. Jennifer Koziol. We'll be right back.
Meet Vault, EverAg's all-in-one risk management platform built to bring clarity and confidence to every decision. With Vault on your mobile device, you get a fast, easy view of the numbers that matter most. Real-time percent hedged, P&L performance, current market data, and more. Vault is here for cattle producers, ready when you are. Download the app for iOS or Android today and take more control of your operations risk management.
I've been a veterinarian since 1987. My wife and I set up a practice in Monette, Missouri in 1989. We started using therapies shortly after it came out. I was overwhelmed with the positive response that we were getting from producers. They could noticeably see a difference. I have to admit that I was pretty skeptical at first. I am currently 110% sold on the product. There is no doubt in my mind that this is an added product that we can use on these cattle that is going to make a significant difference.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed LidoBand, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. LidoBand, a small device that can make a big difference.
Success in the cattle business hinges on a lot of different people playing their part, from the vet to the cowboy and the nutritionist to the feed truck driver. You rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson and Dr. Jennifer Koziol. We're at Texas Tech, where Dr. Koziol is Associate Professor of Food Animal Medicine and Surgery. And does pretty much everything in our industry, from leading us as a veterinary society in the AABP. You're also boarded, correct, in theriogenology?
I'm boarded in theriogenology, yep.
Yeah, and so just one of our leaders, a great bovine veterinarian, and thanks for being on the show.
Oh, it's my pleasure. Thank you for having me.
You bet. Let's talk about the importance and what it takes to what we want to do for like pelvic measurement and reproductive scoring.
Yeah, so reproductive tract scoring and pelvic measuring are two great things that we can make sure that we're breeding heifers that are going to do a good job for us. I think more and more we're using more artificial insemination, synchronization in our heifers to get them bred. And so that's dollars into those heifers. And so we want to make sure that we're going to input those dollars into heifers that have the best chance of getting pregnant and that we actually really want to get pregnant. So we can do reproductive tract scoring. And so reproductive tract scoring, we're going to go in and assess the uterus and make sure that and the ovaries, and make sure that she's actually cycling and that she doesn't have any problems that we can assess. So reproductive tract scoring historically has been scored 1 to 5, with 1 being a very infantile tract or a tract that was incomplete, like a free martin, and 5 was a heifer that was cycling and was ready to go. She had a CL on her ovary and she was ready to go. It was a really hard system for people to get their minds around, because they were like, is 1 good or is 1 bad, and is 5 good or is 5 bad? And so a group at K-State put together the ready, intermediate, and problem system that really kind of groups those together. So ready is going to be very similar to our 4s and 5s. And so those heifers are actively cycling, they're ready to go. Our intermediates are going to be likened to what used to be our 2s and 3s. So we don't detect any problems with the tract. It just is smaller and she's not quite cycling. And then our problems are going to be, we have an incomplete tract, a free martin, something like that. And we need to think about how we divert those females, because they're not ones that we want to breed. So do we turn them into our freezer beef market? Do we just call them from the herd? How do we divert those? Because
Sure.
they're not ones that we want to spend time breeding. And so thinking about that, we can also combine that with pelvic measurements.
Right.
So pelvic measurements are a great way. We're really looking for about 130 centimeters squared is what kind of the industry average is. And we're looking for heifers that meet that. We don't always want to select heifers that are super big for that, because I think that we kind of get into that, a bigger pelvis means that I can put a bigger calf in her. And still it's the thing, right? It's only one size hole and we got to get something out of that hole, right? And so we're really looking for those heifers that are either too small or abnormally shaped, because those are going to be ones that have increased chances of dystocia. So we don't really have to select for bigger. We just have to find the ones that are too small or abnormally shaped.
So working with your veterinarian and doing this just kind of talk about why.
Yeah, so I think it's a great way to think about, we talk a lot about sustainability and just the economics of things. I know everything's becoming more expensive, and being really economically minded about things. And so if we know that heifers are one of the largest and most expensive inputs into a herd. And so working with your veterinarian to find these problems and get rid of these problems before we either waste money breeding them or we have to call our vet out in the middle of the night for a C-section, those are going to help us in the long run, right? And so I'm really passionate about thinking about how do we do a better job on the preventative side so that we don't get on the backside where we have problems. And so really these things do a couple things, right? They find those heifers that are a problem and we divert those. And that's a great different income stream for our operations, right? Those cattle aren't lost. We just divert their income streams. But it also like sets us up to be a more productive herd. We have less problems hopefully going in. Our dollars that we spent on AI synchronization are better put to use. And consequently, we have tighter calving windows. Our labor's happier because calving season's over sooner. And just kind of, it has that effect where everything is a little bit better, everything's a little bit tighter. And we can just do a better job of being a sustainable economic model, right?
It's perfect. We're going to take a break. When we come back, we'll wrap up on heifer development with Dr. Jennifer Kösel.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight-shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it, though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idex.com/DocTalk.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson with Dr. Jennifer Koziol. We're at Texas Tech University here at the School of Veterinary Medicine. Dr. Koziol is a tremendous bovine veterinarian, handles so many things here as an assistant professor in food animal medicine and surgery at Texas Tech. Glad to get her on the show. She's been a wonderful guest, and we've been raising some heifers.
Yeah.
And so now we get into that, time where what we raised them for.
Yeah, we've picked them, we've got them vaccinated, we've done our reproductive tract scoring, pelvic measurement 6 weeks before, we've got them vaccinated 6 weeks before breeding season. It's time to breed them, and I think that's a great opportunity to have had previous conversations and then really reignite that conversations about how and we're going to breed these and what's our plan. And so a couple different ways, certainly we can have our calving geese, low birth weight bulls, and we can do natural insemination with them, natural breeding, or we can go the artificial insemination route. Artificial insemination route really is, I think most of our producers are really going that way with heifers, just because we have access to a larger catalog of those calving geese, low birth weight bulls that have a lot of growth to them, and we can put out those calves that they're going to come out small, but boy, are they going to grow for us. And I think that's really what really has pushed our AI industry and the heifers, is having those opportunities. So once we've got to that point and get ready to set up into breeding season, certainly if we're using AI, make sure that we have our calendar set. A lot of heifers are going to get bred on timed AI calendars. And so really making sure we set out our calendars, we know our days ahead of time, and make sure that we know what protocol and we know what drug is being given when, to give us the best chance, whether you're working with your veterinarian or you're working with your AI sales rep, somebody's coming into AI, those heifers, just make sure that we have that schedule, we know our timing, and we know what drugs go when, because I think that's where sometimes we can get a little off the rails, is that we give the wrong drug then, and then it's always like, how do we fix this? And so having that plan, great communication ahead of time, knowing where we're going and what we're doing. So
any we talked about biosecurity with the bulls,
right?
If we don't have enough heifers, and all of a sudden you add 2 or 3 on, or
right,
a dozen or 40,
a dozen or 40. thinking about biosecurity, we really want good biosecurity, 4 to 6 weeks of quarantine for those new animals, bringing them into it, and so into our herds, right? Before we commingle and mix them, we really want to make sure that we don't bring anything into those herds that we don't want. Make sure other things that we didn't talk about, knowing BVD status on those heifers is great, things of that nature. So we really want to be really tight with our biosecurity. Probably right before breeding's not when we want to bring those heifers in. We probably want to get everything commingled way ahead of time. Probably that before that 6-week window, and just get everybody synced up and tight so we don't have any problems going into breeding season.
It's a lot.
And it's a lot. It's a big job. It's a full-time job, right?
Yeah. Well, I'm just very thankful for your knowledge.
Yeah.
Thank you for sharing it with us and with the audience.
It's my pleasure. Thank you for having me.
Yeah, it was tremendous.
Yeah.
Thanks for watching DocTalk. Remember, if you want to find us on the web, you can find us at www.doctalktv.com. Always work with your local veterinarian. I'm Dr. Dan Thompson with Dr. Jennifer Koziol. We're at Texas Tech University, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.